Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. This is video, I think, number 7 regarding the Michael Mulgrew Florida RTC chapter video. So, off to the videotape.
One, insurance companies, you talk to us. Hospitals, you negotiate with us. We get all the information. We get everything.
And I don't know how you plan on doing that when you're talking about hospitals and doctors all around the country. That's not possible for you to do, Michael. It's more efficient with allowing Medicare eligible retirees who are on the federal public health benefit of Medicare to allow Medicare to administer their health benefit. You're talking about federal intervention. We had federal health care until you try to take it away.
Because that's the strategy that will protect all of us until there's federal intervention that stops this healthcare industry. And that's both the insurance companies and the hospitals and the major medical providers.
And you know that's never going to happen. I mean, in 1996, the state of New York rolled back, Pataki rolled back the 1996 healthcare protections that were in place that were levelizing hospital billing. They were hoping that the economy would level it out on its own. Instead, it ran away like a freight train. You're not going to have federal intervention.
If they're all allowed to continue to just abuse their system to make billions and billions of dollars, then it's going to be a fiasco for everyone. We need federal intervention. We want to keep ourselves safe and take control of our own circumstances.
So you basically took us out of the federal public health benefit and put us in the hands of Aetna, a for-profit managed care insurance company. Yeah, that totally makes sense, Mike.
That's where we're going. And that's where we're at this moment. So we'll wait. No, we're going to wait in a minute. So does anyone want to talk about anything besides this?
Yes.
I don't. Okay. Very patiently, too. Thank you.
What I'm talking about is I'm over 80.
Mm-hmm.
I have cancer.
I'm very sorry.
None of my doctors will take an advantage plan. Because I've asked them. Very few doctors in Florida will take an advantage plan. It doesn't. May work in New York, New Jersey, tri-state area. It doesn't work in Florida.
Okay. So this, and yes, those are the things that have to always be looked at. It's very important. So we spent 6 months on this. That's why we designed a different Medicare Advantage plan, which we were never able to implement. And part of the implementation was to get all of those doctors, show them that they're going to be reimbursed at a higher rate and faster than ever before.
That is not true. Absolutely, that is not true, Mike. Oh my gosh. That is not true. You were implementing a plan and already trying to force people into it. And what are you admitting here, that the plan wasn't ready to be implemented? All of the doctors that are in traditional Medicare, because 99% of doctors in America accept traditional Medicare, they didn't have to worry about this. You now were having to go around the country and convince doctors to take a plan that you were newly creating, customized especially for you, to convince your plan that they would be paid faster than any time before. I don't think you've read the contract, Mike.
The insurance companies want to stop denying. We got all of that in writing legally.
They were not going to stop denying care legally. That is an absolute blatant lie. There are prior authorizations, and you only temporarily suspended a certain number of them, which no one will give us a legitimate number. There were over 10,000 CPT codes. The ones that were in Appendix H of the contract only listed under 400. And then the city was paying a fee of $15 per person per month for those that were rescinded. But you had the ability to renegotiate those every 2 years. So if you wanted to pull more value out of the contract, you would put those prior authorizations back in and pass those costs on to everybody else. There are denials in the plan. It is written that they have the right to make medical necessity. And not only are those determinations made by, I don't know, people that are not your doctors, people who are not treating you against the recommendations of your own physicians, they're also made by AI, Mike, and you know that too.
Right? All the denials would stop, and if we didn't...
All the denials would not stop. Hard stop. Lie, lie, lie. Oh, my gosh. All the denials would not stop, Mike. There is a whole procedure of 5 different levels of appeals for prior authorization. We don't have denials of care now. You were putting our lives at risk by this big lie.
If they didn't get to 100%, then we weren't going to implement. So this is stuff that, yes.
What do you mean if they didn't get to 100%? That they didn't get to 100% of providers in the network? Because that's what you said about a year ago. You already know that Aetna admitted in court that only 88% of doctors we currently see are in the network. And that's not including that we will be needing more doctors as we get older and become more infirm. Aetna will never admit how many doctors in the United States of America are in their network, because that number will probably be close to what I had said the alliance was, which the alliance admitted in court papers was about 75%. Mark my words. You can't even prove that. Please prove that. Prove me wrong. I will come back here and say, I am so sorry. I made a mistake. Come on, Mike.
Has all been thought through. Doctors do not know about this plan because it's never been shown to them.
No, it actually has been shown to them. It's the same contract. It's H5522. It's the same contract that most of Aetna is using for employer-based group waiver plans. It is an Aetna Medicare Advantage plan. It is a Medicare Advantage plan. It operates like every other Medicare Advantage plan. And it's not just the reimbursement that's the issue. You can say that they're going to be reimbursed at the same rate of Medicare. That's not the issue. The issue is all of the prior authorizations. The issue is that the insurance company, has the right to make a determination of medical necessity that right now the doctor makes for you and the network.
But it doesn't exist.
It does.
It doesn't exist.
I called that. Okay, I had an open mind. My husband is on a very expensive drug. Medicare covers most of it. He still has to lay out $2,000 a month on Medicare for this drug. I called Aetna because she claimed that this was a better deal. $7,000.
Okay, so
how could it be better or equal to what we have? It's going to cost them $5,000.
all right, so the call center for Aetna was never fully set up. We sent out a number.
Oh, it absolutely was fully set up, Mike. And Aetna will even admit to you, they were ready to rock and roll when you told them the plan is ready to be implemented. Don't say that they weren't ready to be implemented.
And with all the bad information, but that's the exact thing. See, that's how this would, if this.
Because one of the other things that you're not explaining is that when they did start the rollout, they had a drug lookup tool. So even if you want to say that some nincompoop answered the phone at Aetna and didn't know what the hell they were talking about, although I think that Rick Fromeyer might take umbrage with your saying that, they had a drug lookup tool on their website that you could look up and put the drug name in and the dosage and the quantity, and it would give you a price. So what's your excuse for that?
This thing was implemented. The minute you tell us this, it's fixed.
No, it's not fixed. It
will be fixed, believe me. That is what the system was designed for.
I needed a good laugh. Thank you.
Well, you're welcome. I'm here to please.
And absolutely you pleased, brother, because that everyone in that room knew you were lying to them and knew that you were pulling their leg. Medicare doesn't need any intervention. Federal Medicare doesn't need all of this mess that you're putting yourself in. Right now, you can't even handle managing the money of the stabilization fund. Why would I give my life and my insurance plan for you to manage when you just bankrupted New York City healthcare? Wish I had a microphone. That's really all I got to say. I'm leaving the rest for 8, 9, and 10. See you later.